We've got some big news this morning on the COVID front. Ahead of a potential fall and winter surge, a CDC advisory panel is meeting today to weigh in on a new set of vaccine boosters tailor-made to fight the Omicron variant, just approved by the FDA. Joining us with everything we need to know, Dr. Richard Besser, the former acting director of the CDC, the president of the Robert Wood Johnson Foundation. Dr. Besser, always good to have you. Thanks for your time this morning. Let's start with these two new boosters. Could get approved as soon as today. Who should be in the front of the line to get these shots, Dr. Besser?
Thanks, Craig. I'll be watching very closely to see what the advisory committee to the CDC says. But one of the things that's clear is COVID's not over. More than 400 people are dying in America every day from this. And people's risk varies. Elderly individuals are at greater risk of severe disease, hospitalization, and death, as are people with certain disabilities, certain medical conditions that put them at increased risk. I expect that if the CDC is supportive of what the FDA has now authorized, that they're going to recommend this for high-risk individuals. I'll be interested to see what they say in terms of people who are at lower risk. We don't want, Craig, people to be living in fear, but we do want people to have what they need to reduce their risk.
To that point, if I've had the primary vaccine and I've had two boosters already, do you think I'll even need to get this one?
Well, that's what I want to hear in the discussion. Okay. Thankfully, the younger you are, the lower your risk is of getting severe COVID and dying from this. We still have a lot to learn about long COVID, those symptoms that linger and go on after someone's had an infection. We won't have data to know whether this reduces the chances of that. But as someone who's younger and healthier, that's not something you want to have. The special thing about these boosters is they target the strain of COVID that is the leading strain right now across America. And as we come together, as we spend time closer indoors, the risk of transmission goes up, and I expect we're going to see surges. If that's done at a time where people have added protection against what's around now, I think that will save lives.
BA4, BA5, 90% of folks who are getting COVID right now, those are the two strains they're getting, right?
That's right. Those are the strains that they're getting. And this is the first vaccine that we're going to have here in America that targets those strains. The companies have made boosters against Omicron before, but this is the first time we're going to see those available in our country. What the advisory to the FDA said was, let's wait and target these particular strain that we're seeing in America. That's what these two boosters do.
Really quickly, Dr. Besser, I've read some criticism, some concern that these new vaccines have only been tested on mice so far. Human trials are just beginning. What do you say to that?
Well, these are slight modifications on the previous boosters that were used. This is the same kind of approach that's taken for flu vaccine each year, where if there's a slight change to the vaccine, they allow it to move forward. But I do think some people are going to want to wait. They're going to want to wait and see how it goes as it's given to more people. One of my big concerns, Craig, though, is that the government lacks the resources to get these vaccines out into every community. And as we've seen so far in COVID, the impact of this has varied by community, and they need the resources to make sure that whoever wants this vaccine is really able to get it.
Dr. Richard Besser, always good to have your perspective, sir. Thank you, Dr. Besser.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.